So, good morning, everyone. I am Dr. Vandana. I am presently working as Associate Professor in Lady Hardinge Medical College. I am MD, DNB Pathology. I've done my MD from Lady Hardinge Medical College. I've done my MBBS from Coimbatore Medical College. And post that, I did my DNB. Also, I have worked as a Senior Research Associate in AIIMS New Delhi, post which I was an Assistant Professor in UCMS, and presently I am Associate Professor in Lady Hardinge Medical College. So after lots of queries which we get from the students, uh, the major query that I got was to do CNS, especially CNS tumors. Okay, so uh, this video is intended especially for undergraduates who are going to give postgraduate examination or first year postgraduates who are just starting to learn pathology. So that is why we are going to focus today on only one part of the CNS, because CNS is a very big topic. So we are going to focus today on only one small part of CNS, that is CNS tumors. So to understand CNS tumor, first everybody should be clear with the basic cells of the CNS. So let us understand. When I talk about CNS has basically two types of cells. Okay, so one are neuronal cells. Okay, and the second one are the ganglionic cells. Second one are the glia cells. Okay, so when we talk about glia is further of four types. So first, astrocytes. Second, ependymal cells. Third, oligodendrocytes. And the fourth, microglia cells. And the fourth one is microglia cells. Okay, so let's understand what is the function of each one of them. So as we all know, why I've written microglia separately on the top, because it is mesenchymal in derivative and it is the macrophage, the resident macrophage of the CNS. So this is the resident macrophage of the CNS. Okay. Now we are left now with three types of glia cells. Now what are astrocytes? The name is astrocytes. That means they are star-shaped cells. So they are star-shaped cells. The predominant function that astrocytes have is that they regulate blood-brain barrier. Also, they are the first cells to respond whenever the cell gets injury. So that is, you can treat it as if they are the mother cells. So whenever a child gets injured, they're the first ones to come and help. So these are astrocytes. Ependymal cells are the cells which line the ventricles. Okay, so they line the ventricles. So all the CSF fluid, CSF filled ventricles are lined by ependymal cells. Okay, so how do they look? So they can be from low cuboidal to columnar epithelium, and they usually have cilia. So if they have cilia, this is simple ciliated columnar epithelium. So ependymal cells line the ventricle all around. Okay. Now we come to the third cells, that is oligodendrocytes. So oligodendrocyte, the main function is myelination. So what is the function of oligodendrocyte? They predominantly have a major function of myelination. Okay. So how do oligodendrocytes look? They are like lymphocyte-like cells. So they are like lymphocyte-like cells. But the peculiarity of oligodendrocyte is that they have a perinuclear halo. So they have a very peculiar perinuclear halo. Okay. So now, if somebody asks you, what is the second cell to respond to injury after astrocytes? So that they are microglia cells. So microglia cells, whenever there is some injury, some infection, so they will quickly rush and activate, and they will try to respond to injury. Okay. So any glia, whatever glia cell we have, they have a particular neurofilament in particular intermediate filament in it. And the intermediate filament of glia is called glia fibril associated protein. What is it called? GFAP. Glia fibril associated protein. So any glial tissue has GFAP in it. Okay, so it has GFAP in it. Now, when we talk about neuronal tissue, so neurons are the means who are, transmitting the information from one end to other end. So they are neurons. Okay. So when we talk about neurons, neuronal tissue has neurons and ganglion cells. So they are made up of neurons and ganglions. So they are made up of neurons and ganglions. Okay. And the major information that they do is transmission of information. Now, any neuronal tissue has neurofilament. So what is the intermediate filament of a neuronal tissue? This is neurofilament. Okay. So what is the intermediate filament of a glia tissue? GFAP. What is an intermediate filament of a neuronal tissue? NF. You understand that? So now, today I'm just going to focus on one type of one part of CNS, that is CNS tumors. Okay. So CNS tumors is very easy to understand after you have understood this. Okay, so let's see. So now you have studied that we have two types of tissues, glia tissues and neuronal tissues, isn't it? Glia and neuronal. Okay, so therefore there are two predominant primary tumors of the brain. One that arises from glia. What is that called? Gliomas. So the tumor that arises from glia is called as glioma, and the tumor which arises from the neuronal tissues, okay, are called neuronal tumors. What are they called? Neuronal tissues. Now if somebody asks you how many types of gliomas can be there, look at your chart that you have drawn. So how many types of glia cells are there? Astrocytes, ependymal cells and oligodendrocytes. So how many types of gliomas can be there? Three predominant cells. But then you will ask, ma'am, microglia is also there. So microglia is actually a macrophage of the brain. Okay, so it's a macrophage of the brain and there is no microglioma. So it doesn't give rise to any tumor. It reacts to many conditions, but it doesn't give rise to any tumor. So can I say there is no microglioma? So how many types of glioma are there? Three types. So those which arise from astrocyte is called astrocytoma. So tumor arising from astrocyte is called astrocytoma. Tumor arising from ependymal cell is called ependymoma. And the tumor arising from oligodendrocyte is called oligodendroglioma. So how many types of gliomas are there? Three types. Astrocytoma, ependymoma and oligodendrogliomas. These are broad categories. Okay. Now, just now I told you neuronal tissue is made up of neurons and ganglions. So when I'm talking that they are made up of neurons and ganglions, automatically the neuronal tumors, if I classify, they will be made up of neurons and ganglions. So let's see that. So the tumor which arises here is, let's say, from ganglion first. So tumor which arises is ganglioglioma, gangliogliomas. Okay. Then from neuronal, which has predominant neuronal tissue. Okay. So neurocytomas, neurocytomas. Okay. So neurocytomas and ganglioglioma. Okay. Apart from that, we also have many other types of tumor, but they are one of them you should know, but others are beyond the scope of an undergraduate. At least this much you should know. One more tumor that you should know here is dysembryoplastic, dysembryoplastic neuroectodermal tumor, neuroectodermal tumor. Okay, so dysembryoplastic neuroectodermal tumor. So for all practical purposes, if I'm talking about neuronal tumors, it is made up of neurocytomas, ganglioglioma and dysembryoplastic neuroectodermal tumor. Now if somebody asks you which is the most common type of glioma, so which is the most common type of glioma? Astrocytoma. So most common type of glioma is astrocytoma. Again somebody changes, most common type of neuronal tumor, ganglioglioma. So ganglioglioma is the most common type of neuronal tumor. Okay, but little bit complexity which you should remember here. So what is the name of this tumor? Ganglioglioma. So name is ganglio means neuronal, glioma means glia. So this has some part of the glial tissue also. So now they are considered as mixed neuroglial tumors. Okay, so ganglioglioma can be considered as a mixed neuroglial tumor. Okay, so that's what you should remember. Now, so we have studied two categories of tumors, of brain tumors, that arises from glia, which is called glioma, and that which arises from neuron is neuronal tumor. Okay, so now we have finished about gliomas and neuronal tumors. Okay, so now we have a category of tumors which does not arise either from neuron or from glia. So these group of tumors are called as poorly differentiated tumors. What are these group of tumors called? Poorly differentiated tumors. Okay, so poorly differentiated tumors are also now in WHO 2016. Has been marked update in WHO 2016. So these tumors are also known as embryonal tumors. Okay, so what are they called as? Embryonal tumors, because majority of them occur usually in children. Okay, so that's the maybe the logic, or maybe because they are very undifferentiated or very poorly differentiated, they don't show differentiation in any of the lineages. That is why it's called poorly differentiated tumors. Okay, so poorly differentiated tumors in our brain are of two types. Okay, so we have two poorly differentiated tumors. Let's see what are they. First, always remember medulloblastoma. Okay, so medulloblastoma is a poorly differentiated tumor of the brain. And the second, which tumor you should remember, is atypical teratoid rhabdoid tumor. Okay, so atypical teratoid, okay, rhabdoid tumor. Atypical teratoid rhabdoid tumor. You understand that? So medulloblastoma and atypical teratoid rhabdoid tumors. There are more new category of tumors which are added in this, but again they are much beyond the scope of an undergraduate. Okay, so for now you should at least remember these two. Okay, so medulloblastoma and atypical teratoid rhabdoid tumor. Okay, so this is a poorly differentiated or embryonal tumors. Now gliomas, neuronal tumors, poorly differentiated tumors. Now what else? Now fourth category of the tumor arises from, what does brain has apart from all these cells? WBCs, isn't it? So lymphoid cells. So cannot forget the fourth biggest category of tumors in the brain. What is that? CNS lymphomas. What are this category called? CNS lymphomas. So we have this big category called as CNS lymphoma, which we should not forget in any situation. Okay. Apart from that, now, so these all are primary tumors. So CNS lymphomas can be primary or can be secondary, but I am considering for now primary tumors of the brain. So when I'm considering primary tumors of the brain, so remember, so neuronal, gliomas, poorly differentiated, and CNS lymphoma comes as my first priority that I need to remember. Okay, now these primary tumors of the brain are not very common. Most common tumor in the brain is metastasis. So majority of the tumors that come to the brain are metastatic tumors. So we have a bigger category of tumors called metastatic, which will come later. For now, let's see what we have read. Okay. So now, can you see this star-shaped cell? So what is this star-shaped cell? What do you think it is? It is a astrocyte. Okay, it is a astrocyte. Now, can you focus on this cell? What strikes your mind when you see this? It is a flattened cuboidal type of epithelium. So flattened cuboidal or ciliated columnar is ependymal cells. So they line the CSF line ventricles and they deal with CSF production. Can you look at these cells? These are lymphocyte-like cells and each of them are having a perinuclear halo. So what are these cells? Oligodendrocytes. And look at these cells. Can you see the cells here? So these cells, if you focus, if you see them, they are actually having a elongated nucleus like this. Okay, so it's becoming little bit elongated. So what are these? These are microglia cells. These are microglia cells, and at sometimes they may respond so much that they will become fully long like a rod cell. Okay, so for now, what are these? Microglia cells. So microglia cells can cluster together, and because they are microglia, they are macrophages. Macrophages have a tendency to fuse to form giant cells. So in between this, you can even see that there are giant cells. They are becoming like a giant cell. Okay, so this cluster of microglia cells is called as microglial nodules. What are they called as? Microglial nodules. Always remember, microglial nodule usually occurs around the blood vessels. They usually occur around the blood vessel. So in the center you usually have blood vessel, and this is surrounded by microglia cells. Okay, microglia cells can fuse together to form giant cells, and because they are around the blood vessel, they can sometimes eat up the RBCs and convert it into hemosiderin and become pigmented. So what will happen? They will turn into a pigmented macrophages. So what is the composition of a microglia nodule? Microglia cells, giant cells, and pigmented macrophages. Now these are seen in which condition? HIV. They are seen in HIV. Please remember, microglia nodules are seen in HIV. Okay. Now, I hope you remember when I told you that all the glia cells are usually positive for GFAP. Okay. Now, strongest positivity of GFAP is given by astrocytes because they are the ones who are going to respond maximally to injury. Sometimes when there is injury to the astrocytes or when they're irritated, these astrocytes, star-shaped cells, they can cluster the GFAP. They can cluster the GFAP together. Okay. So we'll be seeing later what happens when the GFAP clusters in them. So for now, you should remember GFAP positive astrocyte is a star-shaped astrocyte, and you can see the star-shaped projections coming out. Okay. So this is a basic configuration of CNS cells. Now, look at these cells. Can you guess about it? What is these? So, they're very, very elongated. So, I told you which cells have a tendency to get elongated. What are these cells? These are rod cells. They are modified microglia cells. I hope you remember we just studied that microglia cells already have little elongated nuclei. So what is that nuclei? So that is activated macrophages. Sometimes they can be activated so much that they become so elongated like this. And these are called as rod cells. So rod cells are seen in syphilis. So these cells are seen in syphilis, which you all should remember. Okay. So now, so are we clear with the basic configuration of the CNS cells and the tumors of the CNS which can arise? Okay. So if I make a basic configuration of CNS tumors now, can I say that CNS tumors is made up of two predominant type of cells, two predominant type of tumors? But before that, what you learned? They can be of two types, primary and secondary. Most common tumor which occurs in the brain is metastasis. Most common tumor that occur in the brain is metastasis. Primary tumors are rare. Primary tumor are rare. When I talk about primary tumor now, so now we have to learn primary tumors of the brain. First, either they can be benign or they can be malignant. Okay, so they can be either primary tumors of the brain can either be benign or they can be malignant. So benign tumors in the brain are more common than the malignant tumors. Okay, and the most common benign tumor of the brain here is meningioma. Which is the most common primary benign tumor of the brain? Meningioma. Whereas when I talk about malignant tumors of the brain, just now you have seen that there can be two types. It can be neuronal or it can be glial. So can I say gliomas and neuronal tumors? Gliomas and neuronal tumors. Now when you studied about the neuronal tumors, you already know basically only there are many, but three should be remembered. So first one is ganglioglioma. First one is ganglioglioma. The second one is neurocytomas. Neurocytomas. Okay, and the third one is dysembryoplastic neuroectodermal tumor. Dysembryoplastic neuroectodermal tumor. Whereas when I talk about gliomas, so again gliomas can be characterized into three tumors. What are the three tumors we can characterize? Astrocytomas, ependymomas, and oligodendrogliomas. Astrocytomas, ependymomas, and oligodendrogliomas. Okay, so that is the basic configuration of CNS tumor. First, you should be very, very clear about it. Now, third, if doesn't fit into anything, neither neurons, neither glia, so what is that? embryonal tumors. So what are the embryonal tumors or poorly differentiated tumors of the brain? Two you have to remember, do not forget, medulloblastoma and atypical teratoid rhabdoid tumor. Atypical teratoid rhabdoid tumor. So that's embryonal tumor. And of course, never forget CNS lymphoma, okay? Primary or secondary CNS lymphoma. When I put PCNSL means primary CNS lymphoma. So are we clear with this configuration of the CNS tumor? Yes. So that should be very, very clear to you. You should be clear uh, till here about these points. Okay. So now we will start going one by one about each tumor and what points we should know about each of them. Okay. So till now you've studied most common brain tumor is metastasis. When I talk about most common primary benign tumor, it is meningioma. When I talk about most common primary malignant tumor, it is glioma. Which is the most common glioma? Astrocytoma. Which is the most common neuronal tumor? Ganglioglioma. Which is the most common embryonal tumor? Medulloblastoma. And what is the CNS lymphoma? So this CNS lymphoma. So here only just remember 2 points which I'm telling you. Okay. So most common extranodal, okay, lymphoma. Most common site of extranodal lymphoma normally is stomach. So most common site of extranodal lymphoma is stomach. But when I say most common site of extranodal, so most common site of extranodal lymphoma in HIV, if somebody asks you, it is always brain. Okay, so primary CNS lymphoma usually occur in HIV positive patients because this is most brain is the most common site of extranodal lymphoma, extranodal NHL, non-Hodgkin lymphoma in HIV patients. Are we clear with this configuration? So with this configuration, let's start one by one about each tumor. So which was the most common brain tumor? Which was the most common brain tumor? Metastasis, isn't it?